These are the stories of the paramedics who race through the streets to answer the call.
Okay, it's coming. It's going into you right now. When we find this patient, she's between two parked vehicles, which seems like a very dangerous place.
So do you know what he hit you with?
He was like rushing me, and I had like a golf club, and then he was like pushed Zach, and he's just like bleeding on the ground.
Nobody deserves this stuff like this and like that, man. I don't deserve it.
What do you think the night's gonna bring us tonight?
I don't know, we're gonna see. We're gonna see how the night goes.
You never know what you're gonna get.
And there's a guy trying to get killed. Whoa, we almost had a patient.
That would have sucked.
He almost got hit by a car on his bicycle.
Base 267, you're responding Bravo for an unknown aged male. It's a laceration to his forehead. Unknown what happened.
We are heading to a residence. Sounds like involved in some sort of domestic dispute. And city police are on scene requesting us lights and sirens.
When we walk into the house, we really need to be aware of the possible dangers. There could be multiple people, there could be weapons. We need to be aware of our surroundings.
Why don't we grab a seat here, and can you take off your hat for me? I just want to get a good look at you. Tell me what happened. I'm just gonna check you out, okay?
I'm not too sure actually. I either got clubbed or kneed to
Clubbed
the
or
head.
kneed? Okay.
Yeah.
Did you lose consciousness at any point?
No, I didn't.
No?
I just
No bumps on your head or neck?
No, just a nice little gash.
How many times was he hit?
Once.
Was he knocked unconscious?
Not at all.
Have you guys been drinking?
He has. I just came home from my soccer game.
And how do you know him?
That's my brother.
Do you know who got you?
Yeah, just a brotherly argument.
Okay. We'll get you out to our truck here and get you dressed up, okay? Get you clean. Now,
You got shoes?
Yeah, I just got my shoes right inside here.
These brothers definitely had a disagreement. Sounds like they had already solved their issues by the time we got there. We just needed to kind of tidy up after.
Let's see. Let's have a look.
Ah, dude.
so do you know what he hit you with?
He was like rushing me, and I had like a golf club.
I'm gonna clean you up here while you're talking, okay?
And then he was like pushed Zach, and he's just like bleeding on the ground.
I hit rocked pretty good.
He was just like freaking out, like really bad.
It turns out that one of the brothers actually filmed the whole entire fight on his cell phone.
Dude, you were coming at me, so I grabbed the golf club. I grabbed the golf club because you were coming at me, and until I was backing up.
I was like freaking out on him too really bad because I was in the moment. I was like just getting tossed around.
Yeah.
And I told you with the fucking golf club, and then you punched me, dude. You punched me as I told you.
And then I was like bitching at him, and I threw his hat at him, and then when I threw his hat at him, he like turned around and like rushed me at like right in my face. Like listen, because he's on top of me.
You gotta fucking me, man! Look at this guy! I threw your hat at you, man! He came after me, so you might go. Tyson, you're going to fucking jail, man!
I was like, look how much I'm bleeding, man.
Shit back at me! I threw a hat at you, guy! You probably broke my nose again, guy!
That's so ridiculous. Holy crap, man.
Okay.
Pretty silly, eh? I put on
Well.
my jeans backwards.
You got dressed in a rush when you found out people were coming. It's honest mistake. Okay?
All family has issues. I have brothers. We all fight a little bit. Sometimes you hug it out, sometimes you duke it out. At the end of the day, you're still family.
We transported the one brother to the hospital. He received 6 stitches in his forehead. He had a CT scan, and he was released from the hospital.
Most brothers over time figure out how to settle their differences without fighting. The brothers say that they deeply regret what happened that night, and they have since reconciled.
Base to 36, you're responding Delta for a 57-year-old male. He's having some chest pain, difficulty breathing. He does have a COPD history.
A cardiac with a little bit of respiratory, or respiratory with a little bit of cardiac?
Yeah, no kidding. Anytime we get called for a patient with chest pain or shortness of breath, we want to get there in a hurry.
He's short of breath, he's got chest pain. I'm thinking he's gonna be sick. You know, time is of the essence.
Hey, this is Darren, he's 57, he's got 8 out of 10 chest pain.
Okay.
Easy at 8 liters a minute.
The firefighters have put the patient on oxygen until we could get there to give him medication. Point to me where your chest pain is on your chest. On the left side there. You're short of breath as well? Okay. I'm gonna take a listen to your lungs again and just see. Take some breaths for me while I listen.
She's 88.
In a normal patient, we want to see oxygen saturations of 95 to 100%. This patient was 88% on oxygen. He's not moving a lot of air. He's silent in the bases. I don't hear a lot of movement, and then he's got an expiratory wheeze on the upper, I heard. We're gonna give you a nebulizer, okay? We're just getting it set up. We need to give this patient a nebulizer of Ventolin and Atrovent to open up his airway. Do you have any other medical conditions other than the COPD?
Lost a lot of weight in the last. How come? I don't know.
Have you been throwing up?
Yeah.
Yeah?
I need more
Okay, it's coming. It's going into you right now.
Focus on your breathing for it.
I couldn't imagine feeling the way this patient feels. You're starving for oxygen, but you can't get any.
What we're gonna do is we're gonna stand you up and we're gonna put a seat underneath your bum.
You know, this guy actually can't catch his breath. So the anxiety comes with it because he's like, you're panicking.
Maybe more of a COPD exacerbation than a chest pain, but
Picture if you were drowning. You know, like the first thing you do is like, you panic and you try to get to the surface, and then you end up using more oxygen.
I can't breathe though.
There's a sense of fear within him. It's compounding our situation.
I don't want that one. We have another mask coming here for you.
Listen to me, okay? We're gonna try this mask. He's not responding to the nebulizer, so we need to try something else. It's a big mask that goes on your face.
CPAP provides continuous positive pressure within the airways, which helps keep the lungs open and alleviates shortness of breath.
We're gonna put this mask on your face, and it's got a very high level of oxygen, and it pushes it in your lungs, okay? Big breaths.
Yeah.
Patients are usually quite fearful of the CPAP mask. You're already short of breath, plus the feeling of claustrophobia. You don't want that big mask on your face. Does it feel better? Yeah?
I guess you can't breathe. That's a reason to be anxious.
We're definitely seeing an improvement in our patient. Our treatment is helping him. His anxiety is decreasing.
So let's see. We got
How is your chest pain now? That you've relaxed a little. So our sats are 99. His work of breathing is decreasing and becoming much easier. That mask is really helping, hey? Yeah, good. I'm glad we tried it.
When you see this patient take a sigh of relief, you can take a sigh of relief. You know, you finally found a treatment plan that has helped this patient. He was transported to hospital and treated for over a month.
For me, good calls are the ones that you just have automatic reactions to. You don't really have to think, you just react.
When somebody is having a true emergency, when I can do something to really help them.
Something that gets your adrenaline going, that makes you think.
Where you know what it is, and you know how to treat it, and you know what you have to do.
Part of the reason I'm here is for the adrenaline rush of it. Some people like jumping out of an airplane. I like to see somebody really sick and then try and fix that.
Base to 36.
You're looking for female patients, white top, black pants, and no unconscious and breathing status at this time.
Right here, right?
Yeah, so we want the alley behind.
This guy, he's on another level too.
At this point, details are vague, and we don't know exactly where this patient is.
Are you guys looking for the girl?
Yeah, is she over here?
Yeah.
Hi. When we find this patient, she's between two parked vehicles, which seems like a very dangerous place. Hello? The way the patient was situated, if a truck would have reversed, it probably wouldn't have seen her. We're gonna sit you up. What's your name? She definitely had the potential to get run over or injured from that vehicle. What's your name? It's okay. We're gonna help you, or the ambulance. Just watch your head, you're gonna hit that mirror.
At this point, we don't know if this patient's passed out. We don't know if this patient's been left here.
Do you wanna take a walk to the truck here?
Regardless of why she's there, it's definitely not a safe place for her to be sleeping.
Are you hurt?
No.
You just drank too much? It's quite clear that this patient is intoxicated, but we still need to assess her and make sure that there's nothing medically wrong with her otherwise. All right, and you were did you throw up?
Not since I went for a run. Last time I went for a run was, obviously December.
We don't want to see this girl end up in the drunk tank or the hospital, so now we need to find her a safe way home. Hopefully we can find her friends to come give her a ride home. Hi, this is Callie with MD Ambulance calling.
You know, we've all been young. We've all probably made decisions that we have regretted.
Would you be able to come get her? Luckily for her, this was a happy ending. She didn't end up getting assaulted or run over by a car. A lot of bad things could have happened.
We've been searching for about half an hour.
You guys got her?
We got her, yeah, we got her.
Fortunately, things turned out well.
I remember when I was 19.
Base to 67. You're responding Delta for a 55-year-old male, having chest pain, not breathing normally.
.55 male with chest pain.
First thing we need to figure out is this cardiac related, or is this more of a muscular issue that he's having?
I haven't tried the door yet.
You got those gloves?
Call an ambulance? Hello? Can we turn on some lights? Can we turn on some lights?
I don't need an ambulance.
Let's just find these lights. Okay, sir, what's happening today?
I had a bad accident there a couple of days ago.
Can I check your heart rate there? I just want to feel your wrist. Okay, you said you were in an accident?
I did a little while ago there. Like I hurt myself real bad here.
Okay.
I don't know, I can't breathe.
How long is a little while ago?
So as we meet the patient, I start to kind of take a look around the apartment.
You got bugs crawling in your apartment all over the place, eh? We could see bugs on the wall, on the ceiling, on the floor.
Bugs everywhere.
There's movement on the floor around the garbage can, and there's movement that's going across the ceiling. BB's in here, let's go.
I'm an IV user.
You're an IV drug user?
What are you injecting here?
Dilaudide's a form of an opiate, kind of like morphine. It's very good for pain control, but it's also highly addictive.
Don't touch any of that.
Let's get you outside. Yeah, grab your keys.
This gentleman's addiction has clearly taken a hold of his life. He started to neglect everything else.
So he's saying that he fell off his bike a couple days ago, just a pedal bike, and he's got some pain to his ribs.
Sorry, that hurts, that little bit of pressure?
How did you get started on your Dilaudid, Richard?
That goes back to 1982.
What happened in '82?
I fell off a roof. I used to be a roofer.
Turns out that about 20 years ago, this guy had a serious work accident and has since become addicted to opiates.
So I used to just pop it. But then I found out it's faster to
inject.
Yeah.
He needs some help. With luck, he'll be able to get that treatment and get his life back together.
Have you talked to your doctor about the methadone program?
I don't want the meth. I'd rather get sick. How long are you gonna be sick for? 3 days?
How long have you been using for?
20 years.
Yeah, 3 days isn't gonna cut it. He seemed pretty sincere that he wanted to quit his addiction once and for all.
I'm gonna beat this.
I think you will.
I'm gonna.
It sounds like you're ready to be done.
I am. I want to stop.
He went to the hospital and was given a chest x-ray and a further cardiac workup. The patient is doing better now. He says he wanted his story told so that others know calling for help is the right thing to do.
Base to 67. City police are on scene with 2 patients involved in a domestic assault. Unknown injuries.
Did they say a domestic?
Said possible domestic, 2 patients. Obviously a family fight.
On the way to the scene, we've got 2 concerns. What kind of injuries are we dealing with? And where is the perpetrator?
going on?
They were both assaulted.
You both got hit?
It's okay. And I seen like lights or
Everywhere.
something.
Hit me everywhere. Hit me in the face and the arms.
With these kind of calls, the patients are oftentimes very emotional.
You can stay right here. We can stay right here.
I don't even know, like...
No, it's okay. It's okay. Anything broken?
I doubt it.
Can you stand up?
You got hit a few times?
Yeah.
In the head?
Yeah.
Does it hurt anywhere I'm touching? I'm trying to hold
Oh.
still.
These women are both really shaken up. They've been in a very emotionally charged situation. They've been assaulted. We need to be able to calm them down so that we can help them.
We're sitting here thinking, like, whatever, right? And then she started acting up, and I'm like, why?
We started beating her when she came to ask the neighbors for some help.
Nobody deserves this. Nobody deserves this stuff like this and like that, man. For real. I don't deserve it.
So this is not part of your day. This is just
Looks like no one's gonna want to come. They are banged up a little bit, but nothing too serious.
You're gonna file a report with the police, right? And hopefully they'll catch him and...
I hope so. She shouldn't be treated like that, man. I couldn't even help her. I didn't even know how to help her.
The perpetrator of this crime needs to know that his acts are not going to go unpunished. If there are no consequences, then acts like this are just going to keep happening.
How are you doing? All right,
Do you guys have him?
The police have him, yeah. I think they caught him. I hope everything works out for you. It's kind of a tough way to spend the night.
Our role with this kind of call is to let our patient know that we're here for them.
If you change your mind about coming to the hospital, just let us know. We're going to be here for a bit yet.
We need to support them, and we need to make sure that they know that they have the resources and the help that they will need.
Can you kind of give me the backstory before you go?
The unfortunate part with it is a lot of times that the victims never get away from it. They're often drawn right back into the same scenario. Hopefully the two women involved in this incident can get the help they need, and this doesn't happen again.
Both of these women are being very brave tonight and have decided to press charges against the assailant. It's very important for a victim of a domestic assault to make her official report to the police. If a report is never given to the police, the abuse will continue to escalate. The only way to deal with it is to stop being quiet.
I slept till noon today, which is better than I've been doing. Crushed out some eggs, read for 2 hours, and went for a run. What'd you do?
I didn't do anything.
Did you run? I ran.
Running's not in the cards for Holly.
To 27, you're responding in Bravo for a 2-vehicle MVC at the intersection of 20th and Avenue P.
This seems bizarre, eh?
20th and P?
That's right up here.
Because this is such a high foot traffic area, I'm concerned that a pedestrian may have been hit.
So the first thing I noticed when we're pulling up to this scene is that there's multiple vehicles involved, lots of damage to the vehicles, high traffic area, so our scene safety is very important on this call.
This is the driver.
Hello, sir.
Yeah, I'm the driver.
Are you hurt at all?
Good luck, hurt?
Do you want to be checked out by EMS?
No, I'm fine.
It's obvious to me that he has been drinking this evening. He's slurring his speech, he's not standing straight, he's not walking straight, and he smells of alcohol.
You told me you had one. Two.
I'll tell you I had one. I told you I had two.
What happened, do you know?
He was from there when he hit my car.
Hit you.
I don't know why he hit my car because we are on the stoplight, so I don't know what's happened.
Okay, your neck doesn't hurt or anything?
No.
This patient is very lucky that he didn't hurt himself or kill himself or somebody else.
Yeah, it's gone.
Often in a call where a drunk driver hits a vehicle, it's the person that they hit that ends up getting injured or killed. And unfortunately, that person that was drunk and made that horrible decision gets to live with that for the rest of their life.
.1967 to base. We're just gonna hover in the 1090 zone for a bit here.
I literally had this premonition that tonight it was going to be busy with like a lot of serious because it is so nice out.
Your spidey senses are tingling?
I don't know.
Base to 28. You're responding Delta for a 74-year-old male. He is unconscious, not breathing effectively. CPR has been started.
Agonal respirations, they're 99 obviously, so CPR is in progress.
We hear the patient's not conscious or breathing. 99 is the code for cardiac arrest.
If we're already in agonal respirations, the chances of him being in a PEA are way higher.
PEA is pulseless electrical activity. It's when the heart has stopped, but the brain is still functioning.
So we'd just be doing epi and CPR, assuming it's the house that's lit up.
We arrive on scene. There's several medics and fire already working the patients.
Yeah, we got it.
51. What do you want us to do? We'll help you in any way.
You want to get like a really detailed history for me? That'd
Sure.
be awesome.
Okay. Do you want to do that?
Yeah.
We need to know if he's had previous cardiac events or if he has a DNR. So I just was wondering if I could get a little bit of history of how you found.
Your epi's in.
We're giving him adrenaline right now, which is our only treatment to get some electrical activity going within the heart.
We have a change in rhythm. Pulses, check his pulse.
And then I looked up and
I don't feel anything.
Okay, let's just sit him up, guys. Sit him up.
wasn't very long before call.
So was he complaining of any pain at all?
Beforehand?
No.
I got it.
We did CPR for such a long time, and he's such a big man, which makes our CPR not the most effective.
So Jesse, I put 2 epi in.
Lucas comes in when all of the rescuers are exhausted. Lucas is a chest compression system that takes the human error out of CPR.
On that side? So as soon as you saw him like that, that's when you called 911 right away?
We are fighting an uphill battle against what is most likely a severely diseased heart.
Check his pulse. I don't feel anything.
I have a bounding pulse.
You do?
Yeah.
Okay.
Finally, his heart is beating again, and Jesse finds a strong pulse in the neck.
So awesome.
Okay, let's get this scoop, guys.
Heart rate of 148.
I don't have any there.
72, red one.
Are we not feeling a pulse?
No, he's a Sicily again.
1967, we're 99 again. We lost it.
Okay, so we're moving.
1, 2, 3.
Okay, watch. Wait.
Do you have any vitals at all?
Was a witness arrest?
Everyone has put so much effort into this call. We're hoping for the best case scenario, but realistically, it's not looking very good.
We continued CPR all the way to the hospital. At the hospital, they resumed efforts, but were unable to get a pulse back.
This job is not a job for every person.
The amount of trauma that we see in our lives is uncomparable.
I think a lot of paramedics don't talk about the way they feel about a call or whether or not they internalize the call.
You can't take things home with you that you've seen or done at work.
It's hard to do. You have to feel, but at the same time, there's a balance.
Once they're done, they're done. I don't remember a lot of the calls that I go on purposely because I don't want to.
It sounds cold, but that's how you survive in this industry.
Running just outside of the restaurant for an unknown age female, taking an overdose on an unknown substance.
Speaking of overdose.
Yeah, hey, you called it.
An overdose on an unknown substance is a really broad term, so we have no idea what we're walking into.
Holy crap, there's a lot of people outside.
All right. We arrive on scene, the patient's on the ground. The situation has drawn a big crowd.
She's my best friend.
Okay. Do you know what she took?
Nothing. She's just been drinking.
Okay.
She gets like this when she's drinking. She's on blood thinners, and she's bleeding a lot right now.
Like from her nose?
From her nose. She fell down and hit her head. This is where she landed.
Okay. We'll get her into the ambulance, okay?
Okay. 1, 2, 3.
She's got a lot of problems. Like she's got like lung issues.
Has she ever had a blood clot in her lung?
Yes.
So she fell outside 2 in her head, so 2 LOCs.
Yeah.
There's 3 places where blood clots can be dangerous.
Well, we had quite a bit to drink, hey?
In your heart, that's a heart attack. In your brain, that's a stroke. In your lungs, that's a pulmonary embolism. So she's on blood thinners because she's had a couple blood clots in her lungs.
So pulmonary embolisms you've had?
And then we're gonna put a little IV in there.
I don't like IVs. Well, we gotta give you one, sweetie, okay? Hey, just relax. Just relax.
The patient is anxious when she hears that we're gonna be starting an IV. She's flailing her arms, she's getting a little more aggressive.
You need one because, hey, listen to me. Listen to me, honey. Hey, look at me. When you go to the hospital, you gotta get a CT of your brain.
Mixing alcohol and blood thinners dramatically increases your risk of a brain bleed, which is a very serious situation.
Curious? You make it so cute.
You don't grab my hair.
Hey.
Before I know it, she has a huge handful of my hair that she's pulling aggressively.
No. Let go.
No.
Paramedics aren't trained in use of force. Police are. They know how to safely restrain a patient.
Hey, listen to me. Listen to me, honey. Hey, look at me.
I feel really bad for the patient and how her night is playing out.
Well, we gotta give you one, sweetie, okay?
It seems this patient has quite the past medical history, and she's obviously had a really rough night, but we're still gonna take really good care of her and take her to the hospital.
You'll be okay.
At the hospital, she was cleared of all medical injuries and had no internal bleeding.
Base to 27, the responding alpha for a 51-year-old male. He's attempted suicide with self-inflicted lacerations. City police are en route.
I'll grab the bandaging kit and the monitor.
Oh, do you think it's those apartments?
Yeah.
When we get called for a attempt, the first thoughts in my mind are the location of the injuries, the depth of the injuries, and the number of injuries. Attempts are a call that we respond to quite frequently, and one of the most important things is to maintain an empathetic tone and respect for the patient when they're explaining the story and the events that led them up to the attempt.
Can I take a peek at these? Let's have a look. Just stay very still for me. Stay still. Perfect, just like that. Nice and still. I assess the patient and I notice that there is a superficial wound on the top of each wrist. When did you do this? You just keep that other hand over there, okay? Keep that other hand over there. 20 minutes ago? What did you use? Scissors? There you go, just keep that hand down.
If they looked
Come
around,
over here and just by his hand,
they could
please.
find
That's okay.
a knife.
Have you done this before?
Yes, many times.
Yeah. The patient tells me that he's attempted suicide several times before. Is it just the wrist? Or anywhere else? Well, we're gonna take you to the hospital and get you somebody to talk to, okay? And we'll take good care of you. Although the wounds are superficial, they still need to go to the hospital to get checked out, and he will need to go see psych. Have you been in psych before?
Yes.
Yeah.
I don't want to hurt anybody.
Oh, we know.
Myself.
I understand.
In this situation, the way Holly handled the call, listening to him, sometimes a person in the situation that he's in just needs someone like that.
Why don't you come with me?
You got some shoes by the door?
For this patient, I think he just needs somebody there for him. I think it's just a cry for help.
It's tough to speculate on the intentions of a person in this situation.
There, now you can see.
Whether they were committed to killing themselves or looking for help, it doesn't really change what we do. Sometimes people are at a situation in their life where they can't cope anymore. And their last resort is to call someone to their house to help them out. And that's the paramedics. He was transported to the hospital, treated for soft tissue injuries, and assessed by psych.
Growing up, I always knew that I wanted to do something in emergency services.
All right, 100, stats 99.
4 years as a paramedic now. It's an absolutely great job, really rewarding. Being Métis, I can relate with some of the people that we deal with. I didn't necessarily have the greatest childhood. Growing up wasn't easy for me. We didn't have a whole lot of money. You gotta kind of adapt and overcome and work with what you have. And I was really lucky to have a lot of family who was able to be really close and support me. At the end of the day, I really appreciate that they were there for me.
I can't even see out of my glasses, they're so dirty.
Very dirty paw prints all over them, hey?
The 20-year-old female patient, she was found hanging. She has been cut down, not conscious. Breathing is confirmed.
Oh God, this sucks.
Don't think about it until you get there.
No. I just, honestly, this is just how my cousin killed herself like not even long ago, so.
Are you gonna be okay?
It just sucks.
Do you need someone else to come?
No, it's okay.
As soon as I see Josh's emotion, and as soon as he tells me his experience, I'm concerned that this call could potentially haunt him.
Do you want them to send another unit? Josh, just, it's okay.
I've had losses in my own life, and I can relate to how Josh is feeling.
1967, I'm gonna need another unit here. My partner is out for this one. It's okay, buddy. It's okay, it's okay.
Right away, some thoughts and some feelings kind of started rushing to me, and as soon as I started getting closer to the scene, I just couldn't really control my emotions.
Okay, it's okay. It's okay. Rob will be there. It's okay. I can handle this until we get Rob here. Fire's here, they can help me as much as they can. Just don't come in. Don't mess yourself up. Okay? Just stay in here. It's okay. I'll be fine. I promise. If I need you, I'll call you, okay? Just stay.
This was an unusual call for me in the sense that it was just so close to the events that happened.
No. Just stay. It's okay.
I'm not concerned about him not being able to perform his job. I'm more concerned he's gonna try and come in and he's gonna try and help me and he's gonna wanna help the patient. But in the end, it's not gonna help him.
Are you awake, honey? What's your name?
It's hard to try to keep everything in all the time. You know, you do your best to try to desensitize yourself, keep everything inside without showing that emotion. There's no real way to prep yourself for somebody who's trying to take their own life. I find some things just have a certain trigger.
Did you lose consciousness when this happened?
I couldn't unconnect myself to what was going on in my life, and that's never happened to me before. When I see her walking out of the house on her own, I am happy that, you know, the outcome wasn't how I anticipated it to be. In May, my cousin who's 17, she hung herself kind of in a similar fashion, and I never had anything like that ever happen in our family, and it was kind of one of those things I just was not expecting.
Those are definitely tough calls. I think everybody's been touched by something like that. So when you have something that hits you with the same age demographic, it's really hard to deal with.
I thought it was gonna be okay.
Josh is young, and Josh is having to learn to deal with kind of the pitfalls and perils of the job. And this one hit him a little bit close to home. Josh and I have a pretty close connection over what it was, because his cousin that took her own life, I was the one that had to work that cardiac arrest and call her.
It hit too close to home.
Need some time to pull yourself back together?
No, it should be okay. Thank you. Oh, just telling Kim, like, that's never happened to me ever.
No. Never lose that human touch, but at the same time, that's why you're going to be good at what you do, because you care. If you didn't care,
yeah,
it wouldn't hit you.
I've been there.
A couple months ago, my cousin committed suicide by hanging. She was only 17. I have never dealt with anything traumatic like this in my family or anything like that in the past. You know, they're always around, so you take a lot of your family for granted, but you never really know until that person's gone how much it's gonna affect you. It's overwhelming.
Delta for a single vehicle MPC on the Broadway Bridge. A female patient in her 20s, possibly unconscious. Breathing has been confirmed.
Okay, copy. Okay, we're going to a car crash on the Broadway Bridge. It's a 25 female, not conscious, breathing, vehicle hit the guardrail.
Driving to the call, I'm thinking, what would cause a mid-20s female to crash her car by herself on the bridge?
Right up there where the cops are.
So seeing the car in the position against the concrete barrier on a bridge like that is unusual. As I approach the scene, I find a female who's sprawled across the two seats.
Hey! Hey!
Her feet are in the driver's seat and her head is over on the passenger side.
Go on that side. Just watch the airbags.
When a car is in an accident, the airbags sometimes have a delay up to a minute.
My dear.
If the airbag shoots off, it comes out at about 60 kilometers an hour.
I want you to just hold nice and still, okay? Okay, Brett, can you reach her hips and I'll pull up on her shoulders?
With the patient's position, we have to assume that she has a spinal injury. We don't want to do anything that could make it worse.
I want you to just hold nice and still, okay? Well, try not to move, try not to move. What happened? What happened, my dear? What happened?
Attempt.
Attempt what?
Hearing that this is a suicide attempt is very concerning. What would be so wrong with this 25-year-old's life that she would try and kill herself?
Okay, do you have any pain anywhere?
My neck and my back.
Your neck and back hurt? Okay, we're gonna get a collar for you right away.
We need to hold her neck and keep her neck in line.
Okay, hold your head still.
And in order to do that, it has to be a team effort to extricate her from the car.
Okay, we're gonna slide you out of the car, okay?
On your count button.
Okay, on 3, 1, 2, 3.
Okay, you got hips.
Hold still.
I got
Hold
C-spine.
still.
I got C-spine. Okay. Ready?
Yep, 1, 2, 3, slide.
You. Let's rotate her.
On my count. 1, 2, 3.
Okay, let's put her legs flat.
Our first step is to get her to the hospital to make sure that she's not physically injured. Once that component's taken care of, we can get her mental health issues dealt with.
Relax, relax. Breathe slowly. Okay.
This person tonight has attempted to commit suicide
Relax.
by crashing into the guardrail and an attempt to hurt herself.
Pupils are equal. Open your, move your jaw.
So we're not only dealing with their physical well-being,
Your mouth hurt?
we're dealing with their mental well-being.
So tell me how you crashed. I did it. You did it? You drove into the cement railing?
It's really unfortunate that this had to come to this.
Lucky you didn't get really hurt.
No, that was the plan. Don't you understand that?
She's struggling with mental wellness and she's struggling with alcohol.
We're gonna take you to the hospital. Got to get you looked at on the inside, okay? Make sure nothing's broken.
She doesn't appear to have suffered a really serious physical injury, but we're going to need to deal with her mental well-being.
She wants to share her story to raise awareness. She's doing much better now and getting help.
Last night, 5, 6 people in a row.
Yeah.
Everything was like a C-test, like 1 or 2.
Responding Delta for a 53-year-old female, conscious and alert. Some shortness of breath with a COPD history.
53 years old.
That's pretty
Young for COPD, yeah.
COPD is a disease which causes damage and destruction to the lungs. It results in progressively worsening shortness of breath.
Yeah, I think it's right here.
When we walk into this room, the firefighters are already treating this patient. She's hunched over, she's struggling to breathe.
She just took Ativan and 1 milligram Dilaudid. Haven't even got her name. She's really struggling here.
So much that I can't breathe.
Part of our treatment is to calm this patient down.
I want you to stay nice and calm for me.
can't.
I know you can't breathe. We have some masks with some oxygen
I need
coming.
fucking air in my feet.
Here, breathe this in. I want you to breathe. There you go. Now we got that medicine. Let's breathe. Let's get a 12-week too.
I'm gonna put some stickers on you, okay? Take a look at your heart.
We're giving this patient a nebulizer, which is a mask with medication that will help her breathe.
Just take some big breaths.
When was the last time you had some shortness of breath like this?
And it's gradually getting kind of bad in the last day or so.
In the last day.
My prednisone, my dilator and my inhalers. I done everything to the T. And it's just my serious COPD. I don't know what it is.
Judy, right now I want you just to focus on your breathing, okay? Just until we can get this under control.
Quit answering me questions there. Still there. Oh, no.
Sorry.
What are you doing, lady?
When a patient is anxious, we have to do our best to try and stay calm so we don't escalate the situation.
Oh.
Judy, just cooperate with us. We're just trying to take a picture of your heart.
She's still showing signs of distress. She's still short of breath.
Oxygen is 95%.
Deep breath.
Her oxygen levels are coming up.
Judy, deep breath.
But there's still no sign of improvement.
Why don't we take this off?
No, don't take my oxygen up.
There's nothing. Yeah, this is oxygen.
This is becoming a difficult situation.
There's more in this one.
Yeah, it's on a
No, you don't
higher.
understand.
She's not calming down. She's not showing any signs of improvement.
1, 2, 3.
She needs to be taken to the hospital.
Don't grab onto anything.
COPD is a terrible, progressive disease that really has no cure. These people that have it struggle every single day. Was transported to hospital. She was admitted and remained in hospital for over a month.
Yeah, times are changing. It's the demand on the paramedic is more than it's ever been.
He's barely breathing, so move fast.
I think medicine has to change to keep up with the changing of times.
Our call volume has significantly increased in the last few years.
Do you know what she took?
The types of drugs that people are using has changed.
Trauma alert for approximately a 35-year-old male.
There's new diseases. There's higher call volume.
More violence.
They're more lethal. There's more trauma. The amount of stress and mental wellness has really changed for our paramedics.
Based at 1867 calls remaining in Alpha for a 51-year-old female household psych issue. Be advised that patient could possibly be violent.
7-4, thank you. She's probably off of her pills.
We usually approach psychiatric patients a little bit differently. We're not sure if they could be violent.
I don't see anybody outside.
Oh, there was someone on the ground there.
When responding to psychiatric emergencies, there's so many factors that remain an unknown. It could be pre-existing, could be mental illness, it could be induced by drugs or alcohol.
What's going on? Sorry? What's happening? Let's sit up. Let's talk
Did she do any drugs tonight that you know of? No?
Can you sit up?
I'm right here. Deal with these people now.
Can you sit up for us?
Has she been drinking?
Yeah, she had a couple shots of whiskey and she shouldn't have had it.
This patient seems very agitated for only having a couple shots of whiskey. It is possible there's something else going on.
I need you to tell me what's going on. Why you need to go to the hospital. Depression. Do you take any medicine?
Yes.
It's difficult to obtain accurate information on these calls, so it becomes hard to treat the patient.
We're gonna stand you up and put you on our bed.
Let's lift your head here.
We're unable to calm her down by talking to her, so we're gonna have to sedate her.
You didn't see her take any drugs?
No, I didn't.
None at all. Does she have a history of doing drugs in the past?
Keep your hand in.
Guess what?
Okay.
You're in the ambulance. You're not going.
Okay.
We're gonna check her out a little bit more in the back of the ambulance, and then we'll take her to the hospital. Here.
When she's in this kind of a state, she becomes a danger to not only herself,
Don't pull on that.
but to myself and my partner as well. The best thing we can do is give her a little bit of medication to help calm her down on the way to the hospital.
Okay, little poke in your arm.
Ow!
These calls are always challenging. I feel that we deal with a lot more mental health calls now than we ever did in the past.
Lower her on my goddamn heart. She's got some issues.
Let's roll her. 1, 2, 3.
How do I deal with it? I don't. Because I love her.
We'll call her. I'll grab one. And
So this lady has some mental health issues diagnosed. I believe she spent some time in a psychiatric facility. Tonight, she's been drinking, doing some unknown drugs, and that's just exacerbated her mental health issues.
It's tragic when people suffer like this.
Tom, St. Paul's.
This patient was transported to the hospital. She was assessed, observed, and later released.
Base to 67, you're responding Delta for a 79-year-old male. He's conscious and alert, complaining of shortness of breath.
This is where the door is. Had to come through there.
This is a messed up spot. Oh, here we go.
So when we first get to this gentleman, we see him through the glass door.
Hello.
When you look at him, his face is sunken, his bones are showing. This gentleman does not look well at all.
What's going on today, sir?
I got pneumonia.
Okay.
Can't breathe that good.
Okay, why don't you grab a seat and I'll grab a quick listen to you. The patient tells us that he's recently had a pneumonia, but the pneumonia is clearly holding on tight. I'm just gonna lift up your shirt. How long have you had pneumonia? The amount of difficulty that our patient's having communicating is really signifying how short a breath he really is. I don't hear any congestion or wheezing at all. He's got a saturation of 75. We get a glimpse at his oxygen saturation at 75%. It should be around 95%. I've got that at 6, and I'm just going to vent that.
Breathe.
Because of the difficulty with the patient's speech,
Breathe again.
it's hard for us to assess the current history of the patient.
Did you say you're missing a lung? What?
Part of it. He tells us that he's a long-time smoker and that he's had part of his lung removed. You couple this with the pneumonia, and no wonder he's having such a hard time breathing.
Okay, let's get you outside.
Still got to do a lot of investigating with this gentleman. It's really difficult to get a history from him because he's having so much trouble speaking in between breaths. Lung sounds are a little bit better now after a neb. No wheezing that we can really hear. He's still quite quiet throughout, but he's really working hard to breathe. We've given him some more medicine and we're going to see how he does. More testing at the hospital once we get there.
It was discovered that his pneumonia had caused an infection in his esophagus that kept him from eating. He spent 41 days in the hospital, and he's recovering and doing much better now.
I've been working with Brett for just over 4 years. He's a very smart medic.
2-3 ABF, and it's big, so we got to keep. So hey, listen, send 2 guys back in here.
Every patient has a story, and that's something that Brett's taught me to never forget.
You're pretty good at that.
The guitar?
Yeah, the guitar and the singing, man. It's pretty good.
Everyone has family, everyone comes from somewhere, and part of being a really good medic is
Okay, I'm just going to check you out, okay?
learning and knowing about your patients.
Hey, there's another call. Let's go.
Base to 67, you're responding Delta for a 24-year-old male. He has a stab wound to the back of the neck. City police are en route.
1967, 10-4.
So when the call comes in to hear stabbing to the neck, I always think, how close is it to the spine? Is this guy going to be paralyzed? How big is the knife? How deep was it put in?
Let's do a really good thorough head-to-toe and make sure he doesn't have injuries somewhere else. Right?
Sounds good.
With any stabbing, we always assume that the patient has an internal injury.
So here we are.
And that bleeding is a potential.
What's happening?
I just got a laceration in the back of the neck.
Is he bleeding pretty heavy duty?
Just gonna get your jacket off here, okay? We want to take a real quick look at you. We want to make sure there's no other injuries, okay?
Okay, there's just one stab.
Okay, how's your head feel?
Feels alright, but my neck feels
Okay. Jaw, nothing hurts there? Do you know what happened? Can you tell me?
I think it was gang related, but I dropped my gang stuff, so.
Okay.
Sounds like this gentleman was involved in an altercation. Sounds like it could be possibly gang related.
Sometimes if a patient has one prominent injury, I'm gonna open up here and take a look at your chest. They're distracted from any other injuries that they may have. No holes in your chest?
No.
Pain in your stomach anywhere?
Just the one stab.
Okay, no, nothing in the back. I gotta check everything, okay? Stab wounds are very hard to assess. We have no idea how deep it goes. It could have nicked an artery, or it could have hit his spinal cord. Nothing in the back anywhere, Brett. I'm gonna steal those tubes there for a sec. Have a listen to them. Take a big breath. Nice and clear all around ×4. Do you have any numbness, tingling in your fingers?
Absolutely. Well, bring me the light. Bring me your light. You got a light?
Yeah, I got a light right here. Let's have a look.
Put it on.
Yeah.
Hang on a second.
Could be.
Okay, does that hurt right there?
Yeah.
I don't know how deep it is, and it's right on his C-spine.
Yeah. Seeing the location of this stab wound, I'm surprised this guy's standing. If it's right on his spine, he should be dead or paralyzed.
It looks to be C3-4 area.
When I look up, it hurts.
Don't look up, okay?
We're taking every precaution, okay? It's very important that he stay as still as possible.
Hi, this is Mike. I'm a paramedic with MD Ambulance. Just letting you guys know, we are on scene right now with a 24-year-old with a stab wound at the back of his neck. It looks to be about 1.5 to 2 inches wide, but it's right on his C-spine.
Okay, so this is just a reminder for you to keep your head nice and still, okay?
Just sit right back. Just sit back. Try to keep your head still. We're gonna turn you, and we're gonna lay you flat on the stretcher.
I got you.
Here, bring your arms into your belly.
We got you.
They're just gonna spin you on Mike's kill.
Okay, you ready? 1, 2, 3.
Good man. Just like that. You okay? We're gonna take you to the University Hospital, okay? And they're gonna go over everything that's occurred. We're not asking for names, they're just asking for what happened and why, the reason for the stabbing and how it occurred.
I kicked him in the leg and then I grabbed him.
Yeah.
And then I think he tried to grab me and then I felt a really weird feeling in my neck and I knew right then and there that he stabbed me.
Given what happened to him, he's very fortunate. Imaging showed that the blade missed his spinal cord by millimeters. He walked out of the hospital later that night.